Hi viewers, welcome to my channel. I am Dr. Homera. Today we will be discussing descending tracts. Descending tracts are the pathway which carry motor signals from brain to lower motor neurons. There are four descending tracts which are characterized into pyramidal tracts and extrapyramidal tracts. Pyramidal tract include corticospinal tract. Extrapyramidal tracts include rubrospinal tract, vestibulospinal tract, reticulospinal tract, olivospinal tract, and tectospinal tract. Let's discuss corticospinal tract. It is the largest descending tract which is also known as pyramidal tract or motor pathway. It has two components, lateral corticospinal tract and anterior corticospinal tract. Anterior corticospinal tract, also called ventral corticospinal tract. Corticospinal tract is the collection of axons which travel from cerebral motor cortex to medulla through internal capsule. Majority of fibers are lateral which decussate in lower medulla, that is pyramid, while anterior corticospinal tract doesn't decussate. After crossing, these fibers continue down opposite side of the spinal cord. Now let's talk about the function of corticospinal tract. These fibers control fine skilled movements of the skeletal muscles. Lesions of corticospinal tract occur either above pyramidal decussation or below pyramidal decussation. If the lesion is above the pyramidal decussation, then weakness is seen in muscles on the contralateral, that is, opposite side of the body. If the lesion is below the pyramidal decussation, then weakness is seen in muscles on the ipsilateral, that is, same side of the body. Now let's discuss extrapyramidal tract. Extrapyramidal tract is the collection of smaller tracts which decussate in pons. Now let's talk about function of the extrapyramidal tract. These fibers control gross motor movement, posture and balance. That's it for today. Thank you for watching.